We begin with COVID-19 as cases continue to rise in almost every state. In a letter obtained by NBC News, the White House Coronavirus Task Force warned states that, quote, "We are in a very dangerous place," unquote. The group is now also urging state officials to, in its words, alert the state population directly. Hospitals are starting to reach capacity in many states, including in Missouri. There are now more than 300,000 confirmed cases across the state, closing in on 303,000. Nearly 3,000 of those cases came in the last 24 hours. At one hospital just outside of St. Louis, there's no more room in the morgue. They had to bring in this refrigerated truck as a temporary holding space. NBC's Ellison Barber joins us now from outside SSM Health DePaul Hospital in Bridgeton, Missouri. Ellison, you were on the ICU floor yesterday, and I understand you got a chance to see just how chaotic things can get. What was that like?
Yeah, Joshua, things here are really difficult right now. They are overwhelmed. This is the hospital where they had to bring in that truck, and they are now using it. We were able to go onto one of the ICU floors. The majority of the patients there have COVID-19, but not all of them. We do want to warn you that some of this video is difficult to watch. What we saw firsthand is that what so many doctors have told us for so long is that other emergencies do not stop because of COVID-19. And we saw that in the moment when a non-COVID-19 patient coded on the ICU floor.
1-5, attention please.
Start ultrasound. I need to break ultrasound.
Everybody clear? Once, twice, three.
Yes, stop.
And when you have a lot of COVID-19 patients in the hospital on top of people who are here for other ailments, other medical care, other emergencies, experts say it strains the entire system. Hospitals like this one or hospitals across the country, they don't have an unlimited amount of resources, be that physical space, beds, medical equipment. They also don't have an unlimited amount of people who can deliver the level of care that people need, particularly if they have wound up in an ICU. And the situation here in the St. Louis area is that the system is starting to become increasingly strained. According to the St. Louis metropolitan area's COVID-19 task force, 90% of ICU beds in this area are currently full. Joshua?
Ellison, what is this doing to the doctors and the nurses there? This has got to be hard on them.
Yeah, you know, when you ask them that, they will all say that this is what they do. They take care of people on their worst days. And not only is it something that they want to do, they're proud to do it. And right now they know that not only are they doing all of the really difficult tasks to give people physical care, but they're also oftentimes stepping in as family members. They're brushing people's hair. They're making sure family members can FaceTime if they're able to with their loved ones when so many people are not able to have visitors. But this is a lot. This is an ongoing issue. It has been 9 months of this now. This hospital, this is their second really big surge, if you will, where they're dealing with such a high influx. And right now they are seeing more deaths than they have ever seen. One of the nurses we spoke to said that they do have some ICU beds open on the floor right now, but it's not because they've been able to send people home. It's because in the last week or so, they have had so many people pass away. The mental toll this is taking on doctors, nurses, all of the healthcare staff here, it's hard to put into words, but here's a little bit of what they told us.
Some of the stuff we have seen and some of the situations having to be that last person, you know, before we intubate someone that they see, and then they never wake up again, and then we have to talk to the family, you know, and be that person as well. I don't think that'll ever go away, those situations, those thoughts. I just do day by day. You know, I want to think that there is light at the end of the tunnel, and certainly there will be, but I don't see anything soon.
It has helped to kind of crystallize my view that I am called to be a nurse. I am called to be here helping to take care of people in their worst moments.
And some of the people that we've spoken to, they have talked about how the situation for them has gone kind of from a stressful environment to an environment of trauma. The nurse, the chief nursing officer, says that she is having to turn now to more support groups for her staff here to make sure that, especially right now, they do know that there are some people who are being discharged and there are people who are making it, because right now the death they're seeing on this ICU floor is a lot. Joshua? Before I let you go, Ellison, that nurse mentioned a light at the end of the tunnel. Is there any relief coming? I mean, what are they telling you about the upcoming winter months? Yeah, I mean, the hope is for, of course, that vaccine, but obviously they don't expect that to be widely available or widely in use for quite a while. But what they're hoping is that by showing people some of what we saw inside of this hospital, letting people hear from them directly, the nurses and the doctors who are dealing with the sickest of the sick, that people will maybe think twice about gathering in large groups without wearing some sort of face mask and take some extra precautions. One doctor said to us, you know, a lot of people were a little more cautious at the beginning, and now it seems like people have let their guards down. And if they understood how serious it was inside here, the crisis they feel like they are at this hospital, then they would understand why doctors and nurses are asking people to take these steps until we can have some sort of big vaccine so that we can stop the spread of the virus. Joshua?
Thank you, Ellison. That's NBC's Ellison Barber joining us from Bridgeton, Missouri.